more room.
You were fascinated by the Ed Schultz method.
Yeah, look at this. This liberal revolt is fascinating and extremely difficult, and the pressure, the liberal revolt puts pressure on House liberals, not so much Senate liberals. And we happen to, I think, have one at the time.
Here with us now, Democratic representative from New York, Congressman Anthony Weiner, and in Washington, MSNBC Chief Washington correspondent Norah O'Donnell joins the conversation.
And Anthony, yesterday we had Ed Schultz, and of course Keith Olbermann came out against it. Arianna Huffington was on the show yesterday against it. Howard Dean was on the show against it. Does that put pressure on progressives in the House to also be against this bill?
Well, to some degree, Ed and Axelrod are having a different conversation. You know, we're not saying that the bill doesn't have good things in it. The problem we have is that every time we turn around, we're losing a fight. And we've kind of allowed for the last several months. Take a look at the checklist of who's been dominating this debate. We spent a month and a half focusing on Olympia Snow. And then it became Bart Stupak and a Republican coalition on choice. And now it's Joe Lieberman and his 7 or 8 positions on his own. And before all of that,
it was Baucus. Progressives were angry when they found out that after the House that Baucus would control the Senate.
Look at the difference with the way Nancy Pelosi and President Obama are dealing with basically the same hand that we have here, which is a very divided country, a very divided Congress. Nancy Pelosi says we're going to try to get a strong public option. She went out, we all went out to try to round up the votes. We were unable to do it. We had a compromise. On big issues, sometimes you have big compromises. The problem is that if I ask 10 or 15 members of the House of Representatives, what is President Obama's position on the public option? I'm not sure that any of them would be able to say we know exactly what it is.
Well,
so there's the sense that he is not in there fighting for the things we care about. We understand there's going to be compromise. That's not the issue.
Can you even guess what his position is?
I think he supports it. But my problem is not whether he supports it, is whether or not he's prepared.
He's been very clear about it. I think he supports it but doesn't need it. Well, he's willing to throw it over. He's said that pretty much all along.
I know, but that in and of itself is an unclear position. I mean, you know what I would like?
In legislation, that's pretty clear.
No, here's what I would like.
We're not going to
here's what I would like. I would like him to go give a speech in Nebraska today.
Yes.
And I'd like him to stand in Ben Nelson's home state and listen, here are the issues. Here are the tough issues your senator has to deal with, and here's what I think he should do. And I need you, all the kids on these college campuses that animated for me, all these people who care about a lower health care and more choice, here's what I'd like you to do. But this is a false choice. It's not that they've got a bad bill on their hands. It's a pretty good bill. I think that Howard Dean is wrong. And I don't think we should let the perfect be the enemy of the good. But I would like a sense, and many of us would like a sense, you know what, when the doors close and all this negotiating is going on, the President of the United States is banging the table, grabbing lapels and say, please, give us the public option, give us your help with this because it's going to lower costs, increase choice. And for those of us who have compromised so many times in this process, that I think is where the concern is.
Norah O'Donnell, talk about the frustration you've heard off the record from Democrats about Barack Obama doing exactly what Anthony Weiner is saying he's doing, which is sort of sitting back and letting the debate play out in front of him.
Well, exactly, and I think the White House now acknowledges that the drop in public approval ratings, what's happening with progressives, is a result of watching this very long, very messy legislative process. And all we talk about is what's wrong with this bill, what's not in this bill, what's no longer in this bill, the public option, instead of what's in this bill. And it's not entirely clear that the process has been very transparent. There are a number of senators, Democratic senators, who have said from the floor of the Senate that they still don't know what's in this whole bill. So I think there's a real onus on Democratic lawmakers and even to the congressmen. What is it in this bill that is going to lower costs and provide more choice specifically?
No, that's easy. I mean, frankly, when you have 30 million people who are uninsured today going into hospital emergency rooms, getting very expensive costs, passing along the burden. We here in New York City pay $6 billion with a B in extra taxes for the uninsured. Theoretically, those people are going to be covered now, so they're going to get the better health care than they're getting today.
How if there's no public option?
I understand there's no public option, but there's 30 million people who are going to be getting health insurance who don't have it today. Those people are going to be getting more efficient, less expensive care, not passing on to you and me higher costs. That's a good thing. That's an unvarnished good thing. The problem that we have here is that indeed there has been a lot of discussion about a few of these top-line issues. Those issues are not unimportant. Public option is important to me. I compromised from a single-payer system that you and I have discussed several times to get to a public option. Now that compromise has been compromised away. The point here is not whether there is a good bill, but whether or not the American people have a sense of the values of the president going into this thing. This is more than just putting a score up on the board. This is a real discussion about who we are, and I'll tell you something else. If you look at the challenge that we face as a party, our problem is with independents, but it's also with people who came in thinking they were going to have a more ideological administration.
Well, I also think part of the problem is that the president promised systematic reform, and this was such a huge bill with such a huge price tag, and the reason that progressives are very upset is it doesn't have the systematic reform that the president promised, and that's upsetting.
Lawrence,
well, let me rise in defense of the president on this. What he did was the opposite of what Bill Clinton did. Bill Clinton waved a veto pen at Congress. He couldn't have been tougher. He said absolutely will not take a bill without, by the way, the forgotten phrase, universal coverage. Universal coverage, which was surrendered by the president and by the House and the Senate. Every Democrat involved in this gave up on universal coverage on day one.
Do you still have your health care card with you?
I do, including the liberals. And so Clinton was incredibly tough. He did everything that people are saying Barack Obama should do, and he got nothing. So we've seen what being incredibly tough in the presidency gets you in this legislative arena.
Is there a strategy behind this?
I don't think there is. Obama is showing you what the other thing. Obama is showing you what the other thing gets you. It gets you nothing. The identical outcome.
Here's what the question is. The question is now, when we're in a conference committee and the president really can't put his finger on the scale, does he do it now? What we're saying is now's your moment, big guy. You're the Mariano Rivera of this situation. You're going to come in at the end, and there's still a chance for them to do it. But I hope the White House...
What can he say?
Hold on, can I just make one point? I hope the White House understands that we, the progressive base of the party, we want him to be successful. It's not like we're rooting against him. Joe Lieberman, a lot of the people who have been causing the problems here are not rooting for success here. Yeah. We are, and so we are the ones that frankly should be listening to.
Universally, everyone's wondering why he's not getting his hands dirty, this president. Is it because this is such a...
There's nothing for him to do. Tell me what the president... Look, Anthony's got a great idea, which is go to Nebraska, okay? Because that's where one of your tough votes is. The trouble is, if he goes to Nebraska, the number one question is, Mr. President, please tell Nebraska how this state can afford an expansion of Medicaid. This bill orders an expansion of Medicaid in all 50 states. There's not one state that can afford it.
Well, let me make a point. Hold on. I want to show you this poll. This is a nationwide poll, and we showed it before about Americans. Do they support the president's plan or not? I'll guarantee you, if he goes out, it's ridiculous because the numbers are mind-numbingly
meaningless.
What? Yes. Let me tell you.
They better be.
I heard Walter Mondale say that the 1984 election. But I guarantee you, this poll and the other poll that shows only 32% of Americans support Barack Obama's health care plan is worse in Nebraska. And so you would be in the 20s in Nebraska, and that would be on the front page of everyone. Ben Nelson. So Ben Nelson would then have the added value of standing up to the President of the United States in Nebraska, and they would put a crown on top of it.
If you believe that there's no value to the bully pulpit of the presidency, you haven't watched any big civic debate in this country in the last 50 years. That's how big bills get done. I'm not saying it's always successful. And by the way, to say between President Clinton
stuff in the news,
President dictating a bill on day one and doing nothing, there's plenty of room. Let me make one point on the facts of the situation. The expansion of Medicaid and the House bill is going to be paid 91% by the federal government.
91. Tell me the state that can afford to pay.
Their overall Medicare expenses are going to go down because they got a few uninsured people. Listen,
that's the dream.
No, that's what's actually going to happen. The uninsured are what the real drivers of Medicaid are.
John Meacham, you know what excites me?